Friends, good evening. I'm Dr. Ashutosh Gupta and I'm a consultant in fetal medicine. So today we are going to talk about prenatal invasive procedures, right? Okay. Since the premise of the fetal medicine is to invert the pyramid, meaning thereby that probably we try to identify how the baby is being formed at something around 12 weeks. So we are doing almost complete level 2 at 12 weeks. Similarly, we are doing those prenatal invasive procedures at something around 12 to 13 weeks, so as to identify that genetically my baby is absolutely great, right? Whenever we intend to do a molecular test, right, a prenatal molecular test in which we need to have a DNA testing, a CVS is a better test as compared to amniocentesis, right? For example, if you want to a prenatal diagnosis for thalassemia or for SMA or for DMD or for molecular testing in which the father and mother they could be a carrier for a single gene disorder, like very recently we have done for a phenylketonuria, right? In that case the CVS becomes a preferred choice of a prenatal invasive testing vis-a-vis with an amniotic fluid or an amniocentesis. Amniocentesis is traditionally being done at 16 to 17 weeks, and by that time the baby is usually more grown as compared to the baby at 12 weeks, right? So today I'm going to show you how the chorionic villi they look like after we do the procedure. तो मैं 4 केसेस आपको दिखा देता हूँ जिसमें आई हैव डन दी CVS chorionic villi sampling. Okay, so it is a blind procedure, but as you can see at the tip of the needle what we can identify is a white chorionic villi, right, which can be very well separated from the maternal tissue. So नीचे जो RPMI fluid है, it has got L-glutamine and some antibiotics so as to nourish the chorionic villi and doesn't allow the fungus to grow, right? So what we have, it is a blind procedure, but what we have identified is this, that by using the same needle that we use in amniocentesis, the yield or the chorionic villi being obtained is adequate for the test intended, right? So this is what the chorionic villi sample it looks like. Chorionic villi sampling or a CVS is a slightly tricky sort of a procedure. First, so we do have our own ultrasound criteria by which we try to identify the maturity of the placenta, and secondly you need to expertise this procedure because CVS or a chorionic villi sampling is a blind procedure, right? And we are using the needle that is being traditionally used for amniocentesis. Earlier we were using a slightly bigger, thicker needle, but now we are using, for the last 1 decade, we are using the same needle that we are using for an amniocentesis to retrieve the chorionic villi, right? And our yield, as I've shown you, is as good as with a bigger needle, right? So whenever we are intending to do a prenatal invasive testing in which I intend to do a molecular test, so we should use we can use the same needle that we use for amniocentesis, and you should choose the consultant who has got an expertise in doing the chorionic villus, and therefore we can check the amount of the chorionic villi being obtained there and then whenever we are finishing of the CVS. Okay, thank you very much for your patient listening.